do your hips click when you're doing leg lifts, flailing your legs around and shit? If so, we're gonna do a few mobility exercises, massages, and then actually some mobility, some strengthening for the hips. So to start, you're gonna be massaging the hip flexors, the TFL, glute med, glute max, piriformis, all that deep stuff in there, and the adductors, just a shotgun approach, massage it all. So right below the hip bone in the front, called the ASIS, you can just massage the hip flexors, iliopsoas, a little bit of the iliacus, and especially the rectus femoris, which is one of your quad muscles and a hip flexor. Then you're going to find your pocket. This is going to be where your TFL muscle is. It turns into the IT band. So if that thing's tight, you might even get some IT band pain. So just rolling over to that, it's about this long, so you don't have very far to move, and you don't need to roll all the way down your IT band to massage it. Next, rolling onto the back side, you're going to be shifting over so that if you find your hip crest here on the back side, you got your butt right above your butt cheeks, right below the hip crest is going to be your glute med muscle. Massage a little bit of that. Roll down so that you get the big boy, the glute, any other deep muscles in there. You can do it with the leg straight. You can cross the leg over. Whatever you do, who cares? Just massage the area and make sure it doesn't hurt so much that you're guarding and tensing up. Lastly, get some of the adductors. So this one's the provocative stretch. You definitely want to do this in the gym once the world opens back up again. So from here, go back and forth, all the way up into the groin, down to the knee. And if you want to, you could also get your hamstrings. Go for it. Now, massage is great. You're also going to want to strengthen the muscles around the hip. Here's a great simple exercise. You don't need a band. So this is a pretty tight band. You're going to work on a hip flexion march, keeping your pelvis nice and level, bringing that knee up high, and simply just work on going either through repetitions or holding for a period of time, whatever you want to do. And then you can also change the angle. Bring that knee out to the side, hit different parts of the hip, and then also out in front, and then rotate. Out front, rotate the other way. So you got internal rotation of the hip, external rotation of the hip. Those are all great exercises. Help build some strength in the hip. Obviously, mobilize it. And if all you want to do is massage it, fine. But that last piece with the strengthening is really going to help.